Otitis media with effusion, OME, is a common condition where fluid builds up in the middle ear without infection. It can cause hearing loss, ear fullness, and speech delays in children. Let's explore the best ways to manage OME, including medical, non-medical, surgical, and hearing support options. In some cases, medication can help, but it's important to know what works and what doesn't. Nasal steroids, such as Fluticasone and Mometasone, are useful if allergies or nasal inflammation are contributing to OME. They help reduce swelling in the Eustachian tube, improving drainage. Antihistamines and decongestants are not recommended for routine OME treatment. As studies show, they have little effect on fluid clearance. Antibiotics are only used if a bacterial infection is present, like in acute otitis media. OME alone does not require antibiotics because it is not an active infection. Most cases of OME resolve on their own within 3 months. During this time, the following approaches may help. Watchful waiting is an option if there is no hearing loss or complications. Doctors monitor the condition without immediate treatment, and regular follow-ups are recommended. Autoinflation, or the Valsalva maneuver, involves blowing gently with nostrils pinched to help open the Eustachian tube and drain fluid. Devices like the Otivan balloon may assist in children. Improving the environment by reducing exposure to secondhand smoke and allergens can help prevent fluid buildup, and encouraging nasal hygiene, especially in children, is beneficial. For persistent OME lasting more than 3 months with significant hearing loss, surgery may be required. Myringotomy with tympanostomy tubes involves making a small incision in the eardrum to place a ventilation tube, allowing fluid to drain. These tubes usually fall out on their own after 6 to 12 months. Adenodectomy may be necessary if OME recurs frequently or if adenoid enlargement is causing Eustachian tube blockage. Removing the adenoids can help, especially for children with recurrent OME. For chronic OME where surgery is not an option, hearing aids can improve sound perception and prevent speech delays in children. They are recommended for adults with persistent OME and hearing loss, as well as for children with long-term OME affecting speech development. OME often resolves on its own, but when it persists, treatment depends on the severity of symptoms. Watchful waiting, autoinflation, and nasal steroids may help, while surgical intervention or hearing aids are options for long-term cases. If hearing loss persists for more than 3 months, an ENT evaluation is recommended.